Right now, it seems like everybody knows somebody with COVID. So what can people do or not do after they've recovered?
Fox 9's Leah Bino spoke with a couple local doctors about what we know and don't know about Omicron immunity and whether those who have recovered from COVID can get back to doing some of the things they like to do.
Yes, to be clear, we spoke with these experts specifically about what they say is the vast majority of cases they are treating right now. Typical immune systems, mild symptoms, especially for those vaccinated and boosted, and what immunity means when there's not much data about Omicron yet.
Waiting for things to end would be kind of the theme of the past. And the theme of current is, kind of living with this.
Chatting with us during her family trip to Florida, Dr. Madeline Gagnon of Gillette Children's Hospital took her 7-year-old twins along to the Sunshine State now that they are fully vaccinated and because they continue to wear masks whenever asked to.
We want to make mitigation a part of our lifestyle, but continue to go on and do the things that we've always enjoyed doing.
She recommends those recovering from the current COVID surge to also continue mitigation strategies, such as masking in large indoor spaces and keeping up with the latest vaccines available to their age group. She also points out for those who have fully recovered from COVID, CDC community guidelines indicate quarantine isn't needed for 90 days unless symptoms develop. If that happens, you are asked to again isolate and test.
So that means that families who've recently tested positive are kind of treated similar to those who have been fully vaccinated and boosted, which allows their family, especially if it went through the entire family, to have more mobility in the community.
If you're also vaccinated, and particularly if you're also boosted, and you got a breakthrough infection, you're about the safest person there is.
Dr. David Hilden of Hennepin Healthcare says natural immunity post-COVID isn't talked about enough, yet tells his patients to keep in mind, especially with Omicron, it's not clear how long protections last. For those who have shied away from things ranging from sporting events, indoor entertainment, air travel, both doctors we talked to say there will likely forever be some level of risk. Yet the first 90 days following COVID recovery, the risk level is somewhat reduced.
I would start to go back towards normal activities, but if there are people who are unvaccinated, particularly children, I would just be a little extra careful and wear your masks and keep your distance from others if you can.
Hilden adds he strongly encourages everyone, regardless of current vaccine or COVID status, to upgrade to higher quality masks, discouraging those fabric masks and opting instead for surgical or KN95 masks. Another layer of the lifestyle seemingly here to stay. Randy, Amy.
All right.